and more children are developing type 2 diabetes. Doctors originally tried treating young patients the same way they care for adults, but a new study shows that traditional therapy doesn't work as well. News 4 medical expert Dr. Peter Ostro reports.
Sarah Chernov was diagnosed with type 2 diabetes when she was 16. That shouldn't happen to a youngster.
It's definitely troubling for anybody who's dealing with such a chronic disease to keep yourself on track, especially when you go through the phases of denial and understanding that this is, a chronic disease.
We're in the midst of an epidemic of type 2 diabetes in children and adolescents, a direct result of the even larger epidemic of childhood obesity. And in youngsters, the diabetes is harder to treat.
Historically, childhood diabetes has not been type 2 diabetes, so very little is known about the right way to both prevent it and to treat it.
She was one of the authors of a report just published in the New England Journal of Medicine. They studied 699 type 2 diabetics aged 10 to 17. Some were treated with metformin, the drug most commonly used to lower blood sugar in adults. But in 52%, metformin alone failed to achieve good regulation. Another group received metformin plus rosiglitazone, or Avandia. That worked better, but still failed in almost 40%.
Treating diabetes in children and adolescents appears to require in many of the children 2 drugs right off the bat.
But Avandia treatment in adults has been linked to a higher risk of heart attack and stroke.
We want them to grow up and have healthy lives and not be having heart attacks and strokes at terribly young ages.
And now many young type 2 diabetics like Sarah need insulin.
The insulin's helping me regulate my blood sugars even more.
We could prevent them from getting diabetes. That would be far preferable than being in the position of treating it.
We can prevent it if we can prevent kids from becoming overweight. Years ago, most kids didn't have to make lifestyle choices to avoid obesity. They ate less and they were more active. Now, we have to somehow get back to that or face the terrible complications of diabetes in young people. The Catholic Health System has a program that might help, and their contact information is on our website at wivb.com.
All right. Prevention is powerful.
Yep.
Thank you, Doc.